Okay, so picture this. You've done everything right, your pet needs some help, ends up at the vet, and they mention needing a blood transfusion. It sounds, well, pretty straightforward, doesn't it? A
Mhm.
solution. But you might find yourself thinking, hang on, what exactly goes on there? Are there complexities, things we should know?
That's a great starting point because that's exactly what we're diving into today. It's definitely more involved than just, hooking up a bag. We're really going to unpack blood transfusion reactions in dogs and cats. We've looked at some expert information to give you a clearer picture.
Absolutely. We've sifted through some pretty detailed stuff, the kind vets use, to pull out what really matters for you. Our mission here is to make this topic, which can sound a bit stressful, feel less like a mystery. So if this ever comes up for your furry friend, you'll have a basic understanding, know what to look out for reaction-wise without getting lost in jargon.
Yeah, and it's important to remember from the get-go, these reactions, while they sound concerning, they can potentially happen with really any blood product used.
Right, good point. Okay, so let's get down to it. When vets talk about reactions, they seem to group them in a couple of main ways. What are those categories?
Well, the two main ways we classify them are by timing, basically. Is it acute, happening right away, or is it delayed, showing up later? And the other way is by how it happens. Is it immune mediated, meaning the immune system is involved, or is it non-immune mediated, caused by something else?
Okay, acute versus delayed, immune versus non-immune.
Exactly. And those acute ones, the ones happening during or right after, those tend to be the most serious, the ones we watch really closely.
That makes sense, the immediate ones being the most worrying. So if something serious is going to happen quickly, like an acute hemolytic reaction, what does that actually look like? What are the signs?
Right. Acute hemolytic, that means the body's actually destroying the transfused red blood cells. And the signs can be quite varied. You might see the pet get really restless, agitated, fever is common, their heart rate might shoot up, that's tachycardia,
Yep.
vomiting can happen, sometimes tremors, weakness, even incontinence or collapsing in severe cases.
Wow.
And if it's really bad, they could go into shock, maybe stop producing much urine, and, the transfusion itself just doesn't work, doesn't raise their red cell count like it should.
That sounds pretty scary, definitely. Now, what about the delayed version? Delayed hemolytic reaction, are those signs as, well, dramatic?
Interestingly, no. Delayed hemolytic reactions are often much, much more subtle. The main thing you might notice, or the vet might notice, is just that the transfusion didn't seem to last. You don't usually get those really obvious, sudden clinical signs. It's more like the red blood cell count starts to drop again, maybe days, even a couple of weeks later.
I see.
It's the body sort of slowly reacting against those transfused cells over time.
Okay, so acute is like this immediate firestorm, and delayed is more of a slow burn where the benefit just sort of fizzles out.
Got it.
Let's move to the other big category. Acute non-hemolytic reactions. Sounds different. What falls under this umbrella?
Yeah, non-hemolytic means it's not about the red cells being destroyed right away by the immune system. But there are still several things that can happen quickly. One big one is an anaphylactic reaction. Think severe immediate allergic response.
Like a bee sting reaction, but from blood.
Kind of, yeah. The signs are similar. Fever, hives vets call it urticaria skin redness, maybe swelling, especially around the face, that's angioedema, and intense itching, pruritus.
Okay, so that's still an immune reaction, just not targeting the red cells directly. What else?
Another possibility, and this one's serious, is a reaction to contaminated blood.
Contaminated how?
If the blood wasn't collected or stored under perfectly sterile conditions, bacteria can grow in it. Transfusing that leads to, well, acute blood poisoning, septicemia, big fever, shock. It really highlights why sterile procedures are just non-negotiable.
Absolutely. Makes sense. Any other types of these acute non-hemolytic ones?
Yep, there's circulatory overload. This happens if the transfusion is given too fast or just too much volume for the pet's system to handle.
Like overwhelming the system.
Exactly. Signs could be vomiting. You might see their neck veins bulging, distended jugulars, difficulty breathing, coughing, sometimes even a bluish tint to the skin from lack of oxygen, and in really bad cases, congestive heart failure. Too much fluid too quickly.
So not the immune system acting up, but more of a plumbing issue, almost overload.
You could think of it that way, yeah. Then there's something called citrate toxicity.
Citrate, that's the stuff they add to stop clotting.
It's the one. It's an anticoagulant in the blood bag. If a lot of blood with citrate is given very fast, the citrate can bind up the calcium in the pet's blood. That leads to low calcium hypocalcemia, and that can make the heart muscle weaker, myocardial depression, and cause general weakness too.
And is that linked to the overload thing?
It can be, yeah. It's more likely if there's circulatory overload happening or if the pet has liver problems, because the liver normally helps clear out that citrate.
Ah, okay, interconnected. What about hyperammonemia? You mentioned liver issues there too.
Right. Hyperammonemia is just high ammonia levels in the blood. Stored blood can actually build up ammonia over time. Now, a healthy liver usually handles this fine, but if a pet already has liver disease, their liver can't process that extra ammonia load from the transfusion, and that buildup can affect the brain, cause encephalopathy.
That's really important if your pet has known liver trouble. Okay, one last one you mentioned was hypothermia. Getting cold from a transfusion. How?
Well, blood is refrigerated, right? It's cold. So if you infuse a large volume of cold blood very quickly, especially into a really small animal or one that's already hypothermic, maybe from shock or surgery, it can drop their core body temperature significantly. You'll see shivering, but the bigger worry is that being too cold can mess with blood clotting. It impairs platelet function.
Wow, okay, it's actually quite a list when you break it down like that. Are certain pets more likely to have these reactions than others?
Yeah.
Who's at higher risk?
Generally speaking, yeah, there are some factors. Purebred cats and dogs seem to be at a somewhat higher risk, and also animals that have had transfusions before. A previous transfusion can sometimes prime the immune system, making it more reactive the next time around.
That makes sense, the immune system having a memory. Let's dig into the causes a bit more. For those acute hemolytic reactions, the red cell destruction, what's usually behind that?
The number one cause, overwhelmingly, is a blood type mismatch. Dogs and cats have blood groups, just like us. Giving incompatible blood triggers a fast, strong immune attack on those transfused cells.
Like giving type A blood to a type B patient.
Exactly, and cats are particularly tricky because they often have strong, naturally occurring antibodies against other blood types. So even a first transfusion can be disastrous if it's mismatched. Also, if the pet has developed antibodies from a previous transfusion or even from certain diseases like immune-mediated hemolytic anemia itself, they're primed to react. And finally, sometimes the red cells themselves might be damaged, maybe stored improperly, frozen or overheated or handled too roughly. Damaged cells can break down more easily.
So careful typing and handling of the blood are just crucial. What about the delayed hemolytic reactions, the slow burn ones?
Those are also immune responses, but usually they're targeting what we call minor red blood cell antigens, not the main AB type things, but other markers on the cell surface. The immune system still sees them as foreign, makes antibodies, but it takes longer. That's why you see the reaction typically like 3 to 14 days later.
Okay, a slower immune attack on less obvious targets. Now, back to the acute non-hemolytic ones. Anaphylaxis, that severe allergy, what actually triggers that in the blood?
It could be a reaction to various things in the donor blood other than red cells. Things like white blood cells, platelets, certain proteins in the plasma, or even things called MHC antigens, which are like cell ID tags. The recipient's immune system just sees something foreign and mounts that big inflammatory response.
And the contaminated blood reaction, the cause there seems pretty, well, straightforward.
Yeah, unfortunately, it usually boils down to a break in sterile technique somewhere along the line. Collection, processing, storage, bacteria get in. Simple as that, but with serious consequences.
Right. And circulatory overload, too much, too fast. Are some pets just more prone to that?
Definitely. Little guys, small dogs and cats just have less volume to start with, so they're more easily overwhelmed. And pets with pre-existing heart problems or kidney failure where they aren't making much urine, we call that oliguric renal failure, they're at much higher risk too. Their systems are already struggling to handle fluids.
Makes perfect sense. Their buffer's already gone. What about citrate toxicity again? You link it to speed and liver issues. Why does the liver matter so much?
Because the liver is the main organ that breaks down citrate. So if you give a lot of citrated blood quickly, especially to a small pet or one whose liver isn't working well, the liver just can't keep up. Citrate levels rise in the blood, it grabs onto calcium, and boom, low calcium and the heart effects.
Gotcha. And hyperammonemia, high ammonia again, it sounds like the stored blood condition, plus the pet's liver health.
Precisely. Ammonia naturally increases a bit in stored blood over time. A healthy liver clears it, no problem. But a diseased liver can't handle that extra load from the transfusion, so ammonia builds up to toxic levels.
And hypothermia, the cold blood issue. Just rapid infusion in small or already cold pets.
That's the main scenario, yeah. Small pets lose heat faster anyway. If they're already cold and you rapidly push in a lot of refrigerated blood, their temperature can plummet dangerously.
We've covered a lot on the types and causes of the acute reactions. What about delayed non-hemolytic reactions? Things that show up later but aren't about red cell destruction.
Two main concerns there. One is transmitting infectious diseases hidden in the donor blood. For example, there was a study that found DNA from Mycoplasma species, nasty little bacteria that infect red cells in about 10% of supposedly healthy cat blood donors. So screening donors is vital.
Wow, 10%. That's quite significant. What's the other concern?
It's something called transfusion-associated graft versus host disease. It's rare, but potentially very serious. Basically, immune cells from the donor blood attack the recipient's tissues as foreign. It's a known, often fatal issue in humans.
And in pets.
Thankfully, it hasn't really been clearly documented in dogs or cats yet, but it's something vets are aware of as a theoretical possibility.
Okay, so maybe a less immediate worry there for pets, but on the radar. Now, let's say a vet suspects a reaction is happening. How do they figure out what's going on? What's the diagnosis process?
Well, the very first step is crucial. Rule out other things. Could the fever be from an underlying infection? Could the hemolysis be the original disease getting worse, not a reaction?
So differential diagnosis first.
Right. Exactly. You have to consider everything else that could cause those signs. Then you do specific tests.
Like what kind of tests?
Oh, standard blood work, a CBC, biochemistry panel. Urinalysis, too. They'll look for clues like, is there free hemoglobin in the blood or urine? Are white cells elevated? Is bilirubin high, indicating red cell breakdown?
And checking for that blood type mismatch.
Absolutely critical. They'll likely repeat the cross-match test, directly mixing donor and recipient samples again to see if they're incompatible. If they suspect bacterial contamination, they might culture the blood bag or do a gram stain. And in cats, especially if hemolysis is seen later, they might run a PCR test for that mycoplasma we mentioned.
So a whole battery of tests depending on the size.
Mm.
Once they confirm a reaction, what's the immediate treatment?
First thing, absolutely number one, stop the transfusion immediately.
Right. Then what?
Then it's all about supportive care. Usually that means intravenous fluids, IV fluids to maintain blood pressure, help the kidneys, keep organs perfused, sometimes a rapid fluid bolus if blood pressure is low. And then addressing any complications, like if they develop DIC, that clotting problem, or go into shock, it's about stabilizing the patient.
Are there specific drugs used for different reaction types?
Oh yes, definitely tailored. For acute hemolytic reactions, they often give fast-acting steroids like corticosteroids to dampen that immune attack. Maybe heparin, an anticoagulant for clotting issues, though that's sometimes debated if there's active bleeding.
Okay.
For allergic signs hives, fever antihistamines like diphenhydramine, maybe steroids too. If it's contaminated blood, strong IV antibiotics are essential, targeting a broad range of bacteria.
And for the fluid overload?
Diuretics like furosemide to help get rid of excess fluid, and maybe oxygen support if they're having trouble breathing.
So a very specific response plan. After the immediate crisis, what kind of monitoring is needed?
Close monitoring is key, really close. Checking their attitude, temperature, heart rate, breathing rate, listening to their lungs frequently. Also tracking their packed cell volume, PCV, protein levels, plasma color. For severe reactions like bad hemolysis or suspected sepsis, they might need more intensive stuff, like measuring central venous pressure or urine output very carefully. Maybe repeat chest x-rays if they suspect lung clots.
It sounds like prevention is definitely the best strategy here. What are the main things vets do to try and stop these reactions from happening in the first place?
You hit the nail on the head. Prevention is everything. First, meticulous record keeping. If a pet reacted before, you need to know exactly what happened. Then, rigorous pre-transfusion testing. Screening all donors for infectious diseases is huge. Blood typing both the donor and the recipient is essential. There are quick typing cards and cartridges for that now.
And cross-matching.
Yes, cross-matching too. Directly testing donor red cells against recipient plasma and vice versa. It's another layer of safety, especially for preventing those acute hemolytic reactions. And just following strict protocols for everything. Choosing healthy donors, collecting blood cleanly, storing it properly, giving it correctly.
You mentioned giving it correctly. Does speed matter there too?
Absolutely. Standard practice is to start the transfusion very slowly for the first, say, 15-30 minutes. Monitor intensely during that time. If there's going to be a major immediate reaction, it often shows up early. Starting slow gives you a chance to catch it and stop it before too much incompatible blood goes in.
That slow start makes a lot of sense as a safety check, and the monitoring continues throughout.
Oh, definitely. Regular checks of all those vitals, temp, heart rate, breathing, lung sounds before, during multiple times, and after the transfusion finishes. More intense monitoring for higher risk patients, of course.
Even with all that care, sometimes things can still go wrong. What are the really severe complications that can arise from a bad reaction?
Yeah, unfortunately, severe acute hemolysis can lead to some grim outcomes. Acute kidney failure is a big risk. Blood clots forming and traveling to the lungs or other organs, that's thromboembolism. DIC, the clotting chaos we mentioned. Dangerous heart rhythm problems, cardiac arrhythmias, and from volume overload, congestive heart failure is possible. In the worst, most rapid reactions, cardiac arrest is even a risk.
Those are definitely serious possibilities. So what's the overall outlook, the prognosis for a pet that has a reaction?
Well, the reaction itself is usually acute, happens quickly, for a pet that was otherwise pretty stable, and if the reaction is caught early and treated fast, the prognosis is generally good. They can recover fully, but it becomes much more guarded if the animal was already critically ill or if the reaction isn't spotted and managed quickly. And sadly, the absolute poorest prognosis is for those cats with type B blood who accidentally receive type A blood. That mismatch is often fatal.
Wow, that really drives home the importance of blood typing, especially in cats. Okay. This has been, well, a really thorough deep dive.
Hmm.
It's clear that blood transfusions, while life-saving, are definitely complex procedures, requires a lot of care and expertise.
Absolutely. What we've seen is that these reactions in pets are really multifaceted, right? Lots of different causes, different signs. It just underscores how vital those strict protocols and constant vigilance from the veterinary team really are.
And hopefully, for you listening, you now have a much better grasp of what's involved, what the risks are, what vets are looking for. That knowledge could be really helpful if you ever face this.
And it makes you think, doesn't it? Given these potential immune reactions, especially, what's next? What kind of future advances in veterinary blood banking or maybe transfusion techniques might help minimize these risks even further for our dogs and cats? It's definitely an area for ongoing work.